Hello everyone, it's Dr. Gupta at the Dermatology Laser and Pain Center. So we're going to go over filler injections today and kind of what my thought is around injecting fillers, because this is really an artistic treatment. It's not just about placing syringes of filler in your face, but actually thinking about where they should go and where they should not go and what we're trying to accomplish with one's appearance. I mean, we obviously want to look more youthful, but we don't want to look just full in the face. We actually want to look trimmer and younger. Oftentimes it's really magical because we will add filler and a patient actually looks slimmer in the face rather than just filled. And we can give more sharpness to areas where it's needed. We can even use fillers in the nose, and I will do that oftentimes. It really balances things out. Lips are really important too because we lose volume around the tissue around the mouth area as well. Just start with filler at the top and then work our way down, because when we add fillers up here in the upper part of the face, it automatically begins to lift the lower face. So for example, if someone has problems with their nasolabial folds or their jowls, really the best thing is to first think about, do we need volume back in the temples? Do we need volume in the upper cheek area? And when we do that, it'll automatically start lifting some of these areas out, because if we just add a bunch of filler into some of these areas, they can look not natural or overfilled, or you might have kind of a ridge that just doesn't look all that great. Other area, of course, that's very popular is the jawline. So I love adding a little jawline filler. It gives a nice crisp separation between the cheek and the neck and gives that beautiful jawline that everybody wants nowadays and should have and deserve to have. So the forehead is a really important area where we also begin to lose volume. Really, we can inject filler up in this area. We can inject it around the brow as well, and injecting filler in some of these areas will actually also help to lift the brow up naturally for us, giving kind of a little forehead lift. Another area where I like to inject fillers is the temple, and I often like to go a little bit further back, almost in the scalp where the hair is, because that area begins to thin out. So this is kind of the area where I like to inject temple filler. And then, you know, along the cheek, you can feel sort of in these areas and in here, sometimes along here. It depends if a patient has festoons, and we want to be careful not to exaggerate the festoons, but kind of work around that to make them disappear and camouflage. I like to often inject a little bit of filler right here in this space, right here in this space. We can also add filler here to kind of lift that chin up, and these are really important key areas where it anchors. And I may add the filler along the jawline like this and up in here. Now, if somebody has lost a lot of volume in their mid face area, in their cheek, then we can use another kind of filler called Sculptra all through this area to build volume back up. And Sculptra is a great filler that can be used in combination with the other fillers as well. Sculptra lays a nice scaffold of collagen in the skin and is just a great filler. And then of course around the lips, we can inject around the lips and we can inject the nose. We can also inject the horizontal lines on the neck. We can also inject filler into the glabellar lines, forehead lines. So just to kind of reiterate, we can inject filler in the glabella, the forehead, the lines, or the forehead in general, the upper brow, temples, lateral, medial cheeks, under the eyes, very carefully, lateral face, nasolabial fold, the pre-jowl sulcus here, and the jawline and the neck, lips and nose.